Welcome to my channel MK Mediguide Lectures, learning with artworks like drawing and calligraphy. In this video, we will discuss about the parasympathetic nervous system. Well, the parasympathetic nervous system is one of the two divisions of the autonomic nervous system, the other being the sympathetic nervous system. Generally, the parasympathetic division acts to oppose or balance the actions of the sympathetic division and generally predominates the sympathetic nervous system in resting state. And that's why it is also called the rest and digest response. Unlike the sympathetic division, about which we have discussed in the previous lecture, the parasympathetic fibers do not overlap with each other and mostly innervate specific organs separately. Besides, the parasympathetic division is also called craniosacral outflow because the preganglionic nerves of this division arise from the cranial segment, which is the brain stem, and from the sacral segments of the spinal cord. By going into more detail on the parasympathetic nervous system, here I am drawing the brain stem and the spinal cord, and that is because the neurons of the parasympathetic division arise from these regions of the CNS. But remember, we will not go into the very deep, but we will just focus on the neurons which are coming out of the CNS and the organs innervated by these neurons and the responses of these organs to the parasympathetic stimulation. So, the preganglionic fibers of cranial regions arise from the nuclei present in the brain stem. Their axons emerge as part of the cranial nerves. Cranial outflow consists of 4 cranial nerves, which include oculomotor or cranial nerve 3, facial or cranial nerve 7, glossopharyngeal or cranial nerve 9, and vagus or cranial nerve 10. In these, the oculomotor or cranial nerve 3 and ancillary ganglion, and then the first ganglionic fibers from here innervate smooth muscle fibers in the eye. This causes contraction of the circular muscle fibers of the iris, and as a result, constriction of the pupil occurs. The fibers of facial or cranial nerve 7 end in pterygoflatin ganglion and submandibular ganglia. First ganglionic fibers from pterygoplatin ganglion supply lacrimal gland, and the parasympathetic stimulation causes increase in tear secretion, while the first ganglionic fibers from submandibular ganglion supply sublingual and submandibular glands, and this causes increase in the saliva secretion by these glands. Fibers of 9 cranial nerve synapse with neurons of optic ganglion. First ganglionic fibers from optic ganglion innervate the parotid salivary gland, and this is also associated with the secretion of saliva. Fibers of 10 cranial nerve or vagus nerve supply visceral organs of the body and carry nearly 80% of total craniosacral outflow and accounts for 90% of free ganglionic parasympathetic fibers in the body. Vagal axons extend to many terminal ganglia which are situated on or near the organs in the thorax and abdomen and supplies almost all the thoraco-abdominal visceral organs, but not the pelvic organs. As the vagus nerve passes through the thorax, it sends axons to the heart and the airways of the lungs. Heart, in response to the parasympathetic impulses, decreases its rate and force of contraction. In addition, this system also causes constriction of the coronary arteries. The parasympathetic nervous system exerts little or no effect on blood vessels except the coronary arteries. Besides, the airways of lungs constricted upon stimulation by the parasympathetic nervous system. This is known as bronchoconstriction. In the abdomen, the vagus nerve supplies the liver and gallbladder, which causes secretion of bile when stimulated. Stimulation of the stomach by vagus nerve leads to secretion of gastric juices and peristalsis increase here. The vagus nerve also sends fibers to the pancreas and in response to stimulation, it increases its secretion of pancreatic juices and the hormone insulin. In addition to it, the vagus nerves also innervate the small intestine and part of the large intestine. And the parasympathetic innervation increase intestinal peristalsis and also increase the secretion of intestinal juices. After this, we have the sacral outflow. The sacral parasympathetic outflow consists of free ganglionic fibers from second to fourth sacral region from S2 to S4 of the spinal cord, as I'm drawing here. Generally, these neurons supply those visceral organs which are not supplied by the vagus nerve. In addition, the free ganglionic fibers arising from this region, called pelvic nerves. These nerves synapses with parasympathetic postganglionic neurons located in terminal ganglia in the smooth muscles, forming the walls of the innervated viscera. From the terminal ganglia, parasympathetic postganglionic axons innervate smooth muscle and glands in the wall of the descending colon, which result in secretion of intestinal juices and increase peristalsis, as it happens with the vagus nerve stimulation. While in rectum, this system innervates the internal sphincter and causes relaxation of internal sphincters. While here, The parasympathetic stimulation of urinary bladder result in contraction of the detrusor muscle and relaxation of trigonal and sphincter muscles. And with this, targeting reproductive organs leads to arousal. And at last, let's briefly discuss the fibers of the parasympathetic nervous system. The preganglionic fibers of parasympathetic nervous system are myelinated, but the first ganglionic fibers are non-myelinated. The preganglionic fibers are longer and reach the ganglia from where the first ganglionic neurons arise, which are situated within the organs or close to the organs innervated by these nerves. And that's why these ganglia are called the terminal ganglia. In most instances, there is a one-to-one connection between the preganglionic and postganglionic neurons, allowing discrete response of this system. And the neurotransmitter at both synapses is acetylcholine. And with this, thanks for watching and support us by subscribing to our channel.